So in terms of treatment, then doxycycline would be the course of treatment. And typically, how long are patients on that?
So when it comes to a tick bite itself, it's only recommended that patients have a single dose of doxycycline. It's a double dose. It's essentially two doses in one. Again, as a single dose after the tick bites happened. That's again to prevent Lyme disease. For patients who are diagnosed with a tick-borne disease, so again, Lyme disease, anaplasmosis, or ehrlichiosis, then we do a more prolonged course. But again, those are patients who have signs and symptoms of the disease. So for Lyme disease in particular, the duration of the treatment depends on the symptoms that you have. So if you have just a single target lesion, a bullseye rash, we call it an erythema migrans, that's recommended to be treated with 10 days of doxycycline. In kids, sometimes we'll do 14 days of amoxicillin, but there are other manifestations, like if you have Bell's palsy, which is a facial droop, or if you have even Lyme meningitis, then we talk about longer courses. The longest course we typically do is for someone who has a swollen joint because of Lyme disease, Lyme arthritis, and that we typically treat with a 28-day course of antibiotics.
For those who are being treated who may have Lyme disease, what does follow-up look like in terms of remediation of symptoms and stoppage of treatment altogether?
So as a pediatric infectious disease doctor, I practice and see patients who are children who have Lyme disease. And I'd like to remind families early on that the vast majority of children with Lyme disease take their antibiotics, respond very quickly to treatment, and are better by the end of the antibiotic course. Of course, there are discussions about can symptoms linger. In some small group of patients, generally adults, there can be a post-infectious syndrome where the bacteria itself is gone and they no longer have symptoms, or they no longer have an infection, but their symptoms are lingering. And we know again that that is a post-infectious cause. It's not due to ongoing infection. In children, that's quite rare. And so for children, again, it depends on the manifestation. It depends on the symptoms of their Lyme disease. But in most cases, by the end of the antibiotic course, the symptoms are totally gone, and many don't require any follow-up at all after, again, their symptoms resolve.
And just lastly for you, doctor, this month, May, is Lyme Disease Awareness Month. What should clinicians and the general public know about it?
And so there are lots of concerns about Lyme disease. It is a growing problem in the United States. We know that its cases are occurring in ever expanding geographic regions, and they're becoming more common in areas where it already exists. But I always like to remind everyone not to panic. Again, firstly, if you've been bitten by a tick, it will happen. But if you know the tools to removing it and how to deal with it, then the chance that you'll go on to having infection is quite low. And also, I'd like to remind parents, again, that when their children do have Lyme disease, the vast majority will improve rather quickly with antibiotics. And once they finish their course, very few will have any lingering symptoms.